My name is Dimitrios Athanasiou. I am a parent of a child with Duchenne muscular dystrophy, and I'm a full-time patient advocate for Duchenne and rare diseases in general. I got my son diagnosed before 4 years ago with this rare disease, Duchenne neuromuscular dystrophy, 3,500 children, and it affects mainly boys. So after we got the diagnosis, it was obvious, coming from Greece, that the knowledge was in a good level, but the advocacy was not in a good level. And so my first task was to organize the parents with a similar condition, with children with similar condition in Greece, and this is where I started from. As I moved forward, it was pretty obvious that I had to get myself trained. I had to know better the disease, I have to know better regulators, I have to know better the process of drug development. So I tried to get some education to help me with my work. I was lucky enough to participate in one of the Euro summer schools, so I had my basic knowledge acquired there. And I was even more luckier to get involved in the EUPATI, which was a longer period. It was 18 months, and it was, let's say, step by step from a naive patient advocate to a patient expert, which was really useful for my work. After the training, I had a very good idea which are the stakeholders, what is the balance and the interest, and how they work together or they don't work together to achieve common goals, and how, as a patient advocate, your job is to facilitate that everybody works together to have new drugs in the market for all the diseases. It gave me a perspective of where do I stand in the whole spectrum of the drug development process. After that, then it offers you the chance to identify in which gaps and which areas you can get specialized, and how you can affect the process faster, and to have faster drugs and to affect it better, and picking up pieces from the EUPATI training and focus on that and do your homework. It gives you the tools to negotiate on a one-to-one basis with all the stakeholders and be in a balanced, let's say, position in the table, because usually the patient advocacy, because of lack of knowledge and sometimes of perception, we are not an equal partner. So training is very important, because you are becoming an equal partner, and when everybody else is in doubt with that, when you are well trained and you do your homework and you study, then you show that you can definitely be a very good partner to work with. I've been involved originally in national advocacy. Then I was involved in our global organization that we have for Duchenne, the United Parent Projects. In my role in the board of the global organization, I had to interact with the regulators, I had to interact with local and European regulators, with HTAs, with pharmaceutical, with academia, in order to produce, let's say, better and cheaper drugs for Duchenne. So in this, with this training, and because we are coming from a rare disease, I had the chance to be a patient expert in the European Medicines Agency, and with this training, it was a very strong tool. This training was a very strong tool to help me do my job there better. So I could evaluate better the clinical protocol, I could evaluate better, understand better the medicines behind it. When I was in doubt, I was always running back to the Moodle and to find everything I need there, or from the toolbox. So it was a backup that was so essential to do my work, at least in the scientific advice and the clinical designs of at least my disease, that we couldn't have it anyway differently. I mean, it's very difficult. I don't know at least something else that can replace it, at least to this level, in the European level. When I started to be a patient advocate, I knew nothing of clinical trials. Through training and through a lot of hard work and exchange with other patients, I was able to understand better the clinical trials and the models that are used in general, and how these models can be adapted to Duchenne muscular dystrophy. After I was strong enough to understand the clinical trials, and after a lot of studying. I'm still participating in the steering committee of a new drug that we try to get on the market, and to make this clinical trial meaningful for our patients. It's very important because we have a lot of clinical trials fail by design, so the feedback and the patient inclusion from the start, it's critical in order to have drugs available for everybody. The informed consent process is a very complicated process, and we have to make sure that the people that are participating in the trial, especially when it comes to children, they understand fully what they're getting in. In our community, in general, the patient advocacy is very strong on that, so we make sure that we consult the informed consent forms, and we try to have it in lay language and to have all the information that the people want. But also for us, as full-time, let's say, patient advocates, it's very important to have somewhere to look in, and for other organizations or for other fellow EUPATI to ask for more experience, because we cannot do solo, we cooperate together, and with their experience you can also turn your experience to the benefit of your own community. I started 3.5 years as a parent with a child with a terminal rare disease, and in 3.5 years I managed to organize, let's say, the advocacy groups in Greece. I'm now part of the board of directors of our global organization, scientific advice patient expert for European Medical Agency, and many other roles and hats that from time to time you have to contribute your experience or your time to move things forward. I would like to add that the only barrier is the barrier we put in our mind, and we should keep pushing till we get the results we need for our patients.